The unwarranted variation we identified was that levels of childhood overweight and obesity were higher in Dudley than the national average. So whereas the national average for reception age children is 22.6% of the population, in Dudley that figure rose to 27.1%. For children in Year 6, the figures showed a similar pattern, with the national average being that 34.2% of children are overweight and obese, but in Dudley our figures are around 39.1%.
Some work had been done around let's get kids fit and healthy eating, and then we realised that if we didn't start young, we were missing an opportunity.
The Let's Get Kids Fit course took place and ran for 6 weeks, and it was run in local children's centres, and the course was made up of about 3/4 of an hour where we did basic cooking skills, and then the other 3/4 of an hour we looked at nutrition and physical activity.
A lot of the research says that when mums have babies, they are more susceptible to research and information about feeding the baby. So it seemed to be an ideal time to start setting up some groups that involved first-time parents and their new babies.
Baby Steps came about simply because we wanted to get the messages across still in a group and continue with support for parents.
Before we implemented our change, we found that parents lacked knowledge around nutrition, around basic cooking skills and around physical activity levels for their children. So we carried out a literature review on the topic of childhood obesity, and we found that the research showed that in order to successfully address the issue, we had to address commonly held parental beliefs, which are firstly that babies cannot be overfed on milk, secondly that crying always signals hunger, and thirdly that your growth is determined by genes rather than by nutrition.
First thing we had to do was think about the content, think about what we wanted to get across to parents, and we wanted to incorporate the previous information that we'd had from the Let's Get Kids Fit.
We talk about nutrition for the whole family and exercise. We talk about introduction to solids for babies from 6 months. We look at baby massage and the importance of touch. We also talk about play and development and sleep routines.
It's been really useful, mainly just being able to talk to different mums and dads in the group, share different experiences. And if I've had any questions, I kind of keep them in my mind and then wait till the group and then kind of ask around. And including the 2 health workers, they've been fantastic.
Yeah, we found it quite good, haven't we? It's been quite informative. Quite enjoyed it.
It's been nice to meet other people as well with children of the same age that are going through the same issues, which has been the most helpful thing, really, hasn't it?
Yeah, it has, yeah.
We did a questionnaire and a focus group at the beginning of the course and a questionnaire and a focus group at the end of the course. The results showed that the course was effective in changing mothers' attitudes around each of the 3 key beliefs, particularly the one that babies cannot be overfed on milk. And in fact, the results changed from 47% of mothers believing that at the beginning to only 8% at the end. And whilst our numbers were small and it's too early to see if it's had a significant impact on the levels of childhood overweight and obesity, it was encouraging that our results showed a significant change in mothers' beliefs in each of the areas. The course also demonstrated that running it was a good use of resources, because obese children have an increased risk of becoming obese adults with all the associated costs with that. I think our work demonstrates commitment to the first 3 of the Leading Change Adding Value commitments, which are around improving population health, more work around prevention, and also around giving individuals, families and communities evidence-based information so that they can make choices to improve their own health.